Hello, my name is Jennifer Goday. I'm a nurse practitioner and I practice here at Everyday Wellness located in Wichita, Kansas. And today I'd like to discuss our allergy program. It is called SLIT and it stands for sublingual immunotherapy, seasonal allergies. So here in Kansas, we're in the top 5 worst areas for allergies. And unfortunately, we only have one actual allergist here in our town. We have several ENTs that have helped fill that gap. But most of our clinicians in the area are offering the subcutaneous immunotherapy, oftentimes thought of as allergy shots. So that basically means you have to go into the office every week, get these shots typically in the back of your arm. You sit there for 30 minutes, the nurse will check you, make sure you're not having a reaction, and then you get to go home. You do that for about 3 to 5 years. Very effective. I have actually gone through that program. It worked wonderfully for my allergies. However, I could not complete the program because I just didn't have the available time. So for me, yes, it was very effective, but my ability to complete that program for 3 to 5 years was basically impossible. At that time, I was getting my master's degree, I was working full time, and I also had young children. And so for me to get to that office every single week with a rotating schedule was impossible. So I kept on getting the same shots over and over again, and I was never able to gradually increase that dose. And luckily, because I'm a provider, they allowed me to do my shots at home, which was the only reason I was able to complete that program. I'm glad I did. My allergies are almost completely resolved. I had horrible allergies. I've even had a sinus surgery before. It was so bad. I'm not from Kansas. I have been here for at least 25 years, I believe, at this point. But I would have tears running down my face all the time because I had the itchy, watery eyes, the stuffy nose, sore throat. Sometimes I get sinus infections. And now currently on really bad allergy days, sometimes I just don't go outside if I know it's going to be a bad day and make me sneeze the rest of the day, or I'll have to take a Zyrtec here and there. But honestly, like my Zyrtec bottle expired. That's how infrequently I take it now. When I decided to offer allergies here in the clinic, because again, we're all about trying to fill gaps here and get this wonderful functional medicine way of practicing into the hands of the everyday person. And so I know how effective the subcutaneous allergy shots are, but I also know how difficult it is to get it completed in the right way for it to be effective. And so when I started doing my research, I found that we have that same technology available just with sublingual drops. So what are sublingual drops? Sublingual just means under the tongue. And so it's pretty much the exact same process as the allergy shots. Instead of doing a shot once a week, you're going to be doing drops under the tongue every other day. Some of these programs vary sometimes to the company that I use. That's our protocol. And since you're doing it every day, that means you're doing it in the privacy of your own home. If you travel, guess what? You get to take it with you. So it makes this program super convenient, very doable for everyone. And we can do it from ages 4 and up. So I love that because when I used to help give these injections at my previous job, I would be giving 2, if not 3 injections to kids as young as 4. And it's for their best interest, 100%. But it was just heartbreaking to see how just traumatized they would be getting, because every Saturday it was time for their shot. And you could just see they just would dread coming and checking in, and that causes us other issues later in life. So I love being able to do these drops. They're great for kids, they're great for adults.